So, recording. So, Rachel, tell me a little bit about your experience, and your healing journey with your daughter.
Um, well, yes, my name is Rachel Bautista, and my daughter is Leslie. She's 17 at the moment. We have had a tough, long journey, but she's put in the work. Where we are at a good place now, but it takes time. So Leslie's 17 right now. She was struggling since she was, I imagine, a preteen, but I really didn't see it till she was 14. Around 14, that's when she hit her first hospital intake, and that was really rough. And of course, I was waiting for her at home, thinking everything was going to be better when she came out. And it doesn't work like that. This is not like a quick fix when it comes to mental health. She went in after her first time in 2021, I believe. She went within 1 year 7 times intaked. And she was just in a cycle. And many people thought she was just going to be in a mental institution even as an adult. But after trying different psychiatrists, I came to find a good counselor, certified, Kuadra Counseling. And there, Leslie actually chose her because I believe the child has to choose who she's willing to talk to. And it's not always about medicines. Leslie was in so many medicines. And
About how many was she on?
I think the most she was on was at 7 daily.
Wow.
And we're talking about high dosage.
What was she diagnosed with?
She was diagnosed schizophrenic, depressive type. But every time she went in the hospital, they had different diagnoses. But they, at the end, would always stay with the most serious one. It was like they didn't want to change what the initial psychiatrist wrote. It was better to play it safe and go with the diagnosis that was more of the, I guess, the severe one, and keep her on those medications than try to decrease. So that's how I saw they played it, or it stayed like that for a while. But when we got to Kuadra Counseling, we were able to pull away from all these labels and medicines and focus more on the conversation with the child, hearing the child. Because I believe if you don't fix the root of it and learn the background of your child, where it started, why she's feeling, and you can't really get to heal her. The medicines are just gonna keep her zoned out. And that's how she was always zoned out, gained a lot of weight, diabetes, blood pressure. She had so many side effects. Weight gain, it's like 70 pounds in 1 year. But now with the Kuadra Counseling, we tried to focus a little bit more away from medicines, and we did different techniques.
Hypnotherapy.
The hypnotherapy, and then one other technique, a newer one that scans your body, because it's also the mind and body have to be in sync. It's abbreviated IMATE. But we did different forms of hypnotherapy, cleansing through your feet, and just a lot of conversation and hearing the child. And Leslie wasn't open at the beginning. I mean, she chose Kuadra, but she wasn't verbally expressive yet because she had so much distrust. But with time, she became more open and she started more participating, and she changed. She actually changed. She actually got better, but it takes time. And I have to emphasize that because she, like I said, she started when she was 14 and now she's 17, and we're at a good place now. But don't stop anything your child wants to do, that she chooses a certain doctor, if she vibes with that doctor, that psychologist, go for it. Listen to that child, because only they will heal themselves.
Which technique do you feel like helped Leslie the most?
I think they all did an equal part, because like I say, for me, it's all about the mind, body, and spirit being in sync. There was some techniques that was more scanning the body, the physical part. There was other techniques that kind of went in more into spiritual cleansings, and then there was techniques that would use just the conversation, the really getting down to know her, which could heal the mind verbally. And so for me, I can't choose a certain technique. I do think it's a lot about having the patience and being willing to be open to trying a lot of techniques. I don't think there's a simple answer to mental health. There's not one technique for mental health. Medicine alone is not a cure. So I would say recommend to anybody and everybody, try different techniques. Don't knock it down until you try it, but you have to have that patience. It's not going to heal. You're not going to heal your child in a month. You're not going to heal your child in 2 years, or even might take longer than mine. But stick to it. Stick to it. Listen to the child. Don't go by maybe things we as an adults were raised with, certain traditions or certain thoughts. Our kids are a different generation. And listen to the child. And Kuadra Counseling, I think, brought in that new style of healing that more the newer generations willing to participate in, and that made a difference.
Right. Thank you.